You take a bite of food, you swallow, and in the next 30 seconds, an entire journey unfolds. It's not just a simple drop down a tube. Oh no, it's a wild, automated adventure with gates, grinders, and even a secret emergency exit. So let's follow the food and see how this incredible system really works.
I mean, it feels so simple, doesn't it? You swallow and that's it. Job done. But what's really going on is this incredibly complex, pre-programmed sequence designed to get the good stuff in and keep the bad stuff out. So let's peel back the curtain. Where does this all kick off?
Every journey has a launch sequence. And for our food, that launch is the act of swallowing. But here's the thing, it's a handoff. It starts as a choice you make, but in a split second, it becomes a reflex. Your body completely takes over. Let's break that down.
Okay, so there are 3 phases. First step, the oral phase. This is all you. You're in the driver's seat, chewing, deciding, yep, time to swallow. But the second you push that food to the back of your throat, boom, the pharyngeal phase kicks in. Your body takes the wheel. It's a pure reflex, totally automatic. Your airway gets sealed off, super important, and then it's on to the esophageal phase, where powerful muscles just start squeezing the food down towards your stomach.
So that food is now in the esophagus. And you might picture this as just a simple slide, right? A floppy tube? Nope. Think of it more like a highly regulated muscular highway with some very, very strict rules. Yeah, the esophagus has a really tough gig. It's got this dual mission: get food down, but at the same time it has to prevent 2 things: air from getting in from the top and nasty stomach acid from coming up from the bottom. It's a constant juggling act. So how does it manage this balancing act? Well, it's got 2 crucial gatekeepers. At the very top, you've got the upper esophageal sphincter, or UES. Its job is to stay clamped shut so you're not just swallowing air all day. Then way down at the bottom, there's the lower esophageal sphincter, the LES. This one's the critical barrier that stops stomach acid from splashing back up. It's a one-way door. And here's something that's actually kind of mind-blowing. The esophagus isn't just one type of muscle. The top part is skeletal muscle, the kind you consciously control. But the bottom is smooth muscle, which is totally automated. And this isn't just a fun fact. For doctors, this is huge because some diseases only attack one type of muscle. So knowing where the problem is can help them pinpoint the diagnosis. Pretty clever, right? Okay, let's get real for a second. Have you ever had that horrible feeling where food feels like it's just stuck right in your chest? Well, that's not just you being dramatic. It's a real medical symptom called dysphagia. And believe it or not, what gets stuck and when it gets stuck gives doctors some major clues about the cause. So here's the detective work. If you first start having trouble with solids, like a piece of bread, but liquids are still going down fine, that usually points to a mechanical problem, a physical blockage, like the pipe is getting narrower. But if you have trouble with both solids and liquids right from the start, that suggests a motility issue. It's not a blockage, it means the muscles themselves just aren't squeezing and moving properly. All right, so the food has made it past the esophagus. Destination, the stomach. And folks, this is where things get intense. We're talking about a chemical grinder, a powerful acid pit. The stomach's job is to churn and dissolve everything we eat. But the biggest question is, how on earth does it do all that without digesting itself? Well, it's all about having a highly specialized workforce lining the stomach. You've got your parietal cells. These are the heavy lifters, pumping out hydrochloric acid. Then you have chief cells, which kickstart protein digestion. G cells are like the floor managers, telling the parietal cells to ramp up acid production. And then, maybe most importantly, you have the mucus cells. They're the safety crew, laying down a thick, protective barrier. Seriously, the stomach's armor is just genius. It's a multi-layered defense. You've got that mucus layer that's constantly neutralizing acid on contact. The cells of the stomach wall are packed together with these super tight connections so nothing can leak through. And on top of that, there's incredible blood flow right underneath, ready to whisk away any acid that might get too close. It really is a fortress. But, sometimes even the best fortress has a breach. What happens when this system goes wrong, when acid wins the battle? That's when you get things like acid reflux. So let's talk about the body's warning signs and what we can do about it. So when that lower gatekeeper, the LES, fails and acid keeps splashing up into the esophagus is in trouble. It wasn't built for that. So it does something incredible to survive. It changes. The normal cells get replaced by a tougher, more acid-resistant cell type.
This adaptation is called metaplasia. It's the body trying to protect itself from chronic injury.
Now, it's really important to get this distinction right. Metaplasia, that adaptive change, is reversible. If you stop the acid exposure, it can go back to normal. But if the stress continues, that metaplasia can progress to something called dysplasia. And that's different. Dysplasia is disordered growth. The cells are starting to look weird, and that is a serious warning sign because it's considered a precancerous step.
This is exactly why we have to listen to our bodies and pay attention to the red flags. I'm talking about things like difficulty swallowing, losing weight when you're not trying to, persistent vomiting, or painful swallowing. These aren't just, oh, I'll wait it out symptoms. These are your body screaming that something is wrong and you need to get it checked out.
Okay, so how do we fight back against too much acid? Well, to stop something, you have to know how it starts. And it turns out there are 3 main go signals that tell the stomach to start pumping acid. You've got a signal from a nerve, a signal from a hormone called gastrin, and a really important one from a chemical called histamine. And knowing those 3 signals is the key to how our medicines work. For example, H2 blockers. They block that histamine signal, which dials down acid production. But the big guns are the proton pump inhibitors, or PPIs. They go right to the source and shut down the actual acid pump itself, making them super effective. And of course, for that immediate uh-oh feeling, you have antacids, which just go in and neutralize the acid that's already there. Fast, but temporary.
Okay, we've talked about getting food in and keeping acid down, but what happens if something truly bad gets past the gates? A toxin, a virus? Well, the body has an emergency exit, an eject button. We call it vomiting. And while it feels awful and chaotic, it's anything but random. It's an incredibly coordinated, protective reflex.
So how does the body decide it's time to pull that emergency lever? There's literally a vomiting center in your brain that acts like a command post. It gets intel from all over, reports from your gut, from a special zone that samples your blood for toxins, and from your inner ear, which is why motion sickness is a thing. When this command post gets enough danger signals, it initiates the launch sequence.
And just like with acid blockers, because we figured out these different communication lines, we can design drugs to intercept the messages. Anti-nausea meds are super targeted. A drug for motion sickness? It's going to block the signals coming from the inner ear. A drug for nausea from chemo? That's going to target the signals coming from the gut. It's all about knowing which pathway to shut down.
So when you step back and look at the whole thing, from that conscious choice to swallow to the automated highway of the esophagus, the chemical warfare in the stomach, and that super sophisticated emergency exit, it's just staggering. Our digestive tract is this beautiful, complex, and totally automated machine. And that leaves us with a pretty wild thought to chew on. We just saw how the body can literally change its own cells just to survive chronic stress. So it makes you wonder, what other unseen, unbelievable adaptations are happening inside you right this second to keep everything running? It's a powerful reminder that our bodies are constantly fighting for us in ways we can't even see.